Hi everyone, this is Prithviraj. I am certified sleep technologist from Indian Board of Sleep Medicine. Today I am going to demonstrate how a home sleep apnea test is done. Basically it is also called as level 3 home sleep apnea test. So here is the device, very simple. It has 4 parameters to record. One is the chest effort, one is nasal pressure through a nasal cannula which records even the snoring as well, and you have a pulse oximetry which records heart rate and oxygen levels in the blood throughout the night. So here is the device. So this is the main unit of the device. So this is to be placed on the chest. So basically the sensor should be somewhere close to heart, and then we have to just take the belt and we have to wrap the belt in such a way that patient is comfortable. It shouldn't be too tight also and too loose also. If it is too loose, when patient wakes up for washroom, it will fall down. If it is too tight, it will be discomfort for the sleeper and then they will not be able to sleep properly throughout the night. So you have to make sure it doesn't fall and you have to place it in there. So here you are connecting the chest effort sensor, and next you are going to connect the pulse oximetry probe. Here there is a notch and you have to just push it inside, and this clip to be placed towards the opposite side, and again the pulse oximetry probe into the index finger, and then you have to take a cannula which is like call it as nasal cannulas, which records the snoring and the nasal pressure throughout the night. So here you have to just lock it and then place this into the nostrils. Initially there will be little irritation, later it will be comfortable for them. So that irritation you need to bear initially, and then you pull this up and make it tight. So still, if you don't want the cannula or pulse oximeters to come down, you can use a micropore to place both sides here and wrap one for the finger, which I will show you now. Place it on the cheeks where the cannula tube is connected, both the sides, so that it won't fall during the entire night process when patients moves towards left or right. And even one micropore to the finger so that it holds tight and even the oximetry probe doesn't come out. So once this is connected, then patient can comfortably go to sleep and he can turn left, right, any direction, and whenever he wants to go to washroom, he can go to washroom and come back. After connecting all these things, you have to just press and hold the switch on and button. Once you click on, the green light will come and all sensors will start with the red blinking, and slowly it will start the green lights. When green lights are appearing to all these 3 points, that means the recorder is started. So once recording is done for 8 hours, next day morning we can disconnect the device, connect the device into the system and download the report. Thank you.